Hello everyone, I am Dr. Srinath, consultant neurosurgeon at Renova Hospital, Kompally. Today I am in front of you to speak a few words on brain stroke, or what we call as a cerebrovascular accident, and most commonly called a stroke. So whenever we suspect a person to be having a stroke, when he has abnormal behavior in the form of a change in speech, lack of vision, lack of movement of any of the limbs of the body, and instability of the body, as well as any other minor abnormality which the patient can himself tell about. So when we suspect a patient he is having a stroke, the first important thing would be to get him to the nearest possible brain specialist in the form of a neurologist or a neurosurgeon who will assess clinically and also get a patient to be radiologically investigated in the form of an MRI. When the MRI shows the presence of a stroke, it can be either one of the two. One first being a bleed into the brain, is called a cerebral hemorrhage, or it can be an ischemic or the cutoff of the brain supply to a part of the brain called a ischemic cerebrovascular accident. So the most important thing which we can help the patient will be an ischemic cerebrovascular accident when there is a block into the major blood vessel in the brain, leading to the damage to the brain cells in that part of the brain, and if neglected can lead to permanent damage. So whenever we suspect an ischemic stroke and with the possibility of major artery being blocked and is being confirmed with an MRI, the most important thing which we can do is to act in the golden period of the stroke, which is in the first 4 hours of the onset of symptoms. So within the first 4 hours, if we can identify a major vessel block in the brain and initiate the treatment known as thrombolysis, then we can immediately access the patient's vasculature and then give the treatment which can lead to a near normal recovery and near total normalcy of the patient. If the patient has any delay in the onset of treatment, the result might not be optimal or satisfactory. Even then, if the patient has come to us after the golden period, even then we will have to initiate the treatment as early as possible in the form of clot busters or antiplatelet agents, thrombotic treatment, so that the possibility of reversal of the clot, dissolution of the clot, and establishment of the circulation into the damaged brain is as recovered as early as possible. We also have to remember that most of these patients already have existing conditions such as diabetes, hypertension, or smoking, alcohol consumption, or asthma. So that these factors have a contributing hand in this establishment of the stroke. So whenever we have the diagnosis of a stroke and the patient has symptoms of raised intracranial pressure, the patient has to undergo a surgery called as a decompressive craniotomy, where the part of the skull is removed to decrease the pressure inside the brain and to allow the brain to expand and outside the skull instead of inside and damaging the normal part of the brain. This surgery is commonly prescribed for patients with raised ICP, whereas the patient is continuously deteriorating in his status and a repeat of the CT scan has shown the pressure increase in the brain. So after surgery, usually the recovery is slow, long duration, including treatment of medical, physical rehabilitation and occupational rehabilitation. So the other type of stroke is a hemorrhagic stroke, where there is a bleed inside the brain, which can be found in any part of the brain. Most commonly, it is found in the center of the brain in the area called as capsuloganglionic region. And the most common reason for this bleed is the raised blood pressure, long-standing effects of diabetes mellitus, long-standing effects of hypercholesterolemia, leading to blood vessel damage and breakage of the blood vessel in the brain. So when we find a bleed in the brain, the most important thing to be assessed is the size of the bleed. Where if the bleed is large, then the patient has to undergo the same decompressive craniotomy procedure so that the pressure in the brain is decreased and brought back to normal, and the brain is allowed to time to recover, and so that the normal part of the brain beside the bleed is not being damaged. So if the brain bleed is large, then directly the bleed has to be removed to as much as possible and followed by allowing the brain to relax with the decompressive craniotomy and make the patient recover in the ICU with appropriate medication, management of comorbid conditions like hypertension and diabetes, as well as assist the recovery in the form of physical rehabilitation and further the occupational rehabilitation. So the nearest possible doctor has to be consulted immediately as early as possible for the best possible result. Thank you.